Welcome to a new episode of Science in Context. I'm Sabine, and this week Dr. Lucia Okell, Professor Kelly Roper and Dr. Andria Mousa join me to speak about malaria prevention and drug resistance. Lucy, what exactly is malaria prevention and why is it so important?
So preventive treatments given to especially children who are at high risk of malaria, the idea is that before they get sick, we give them the drug so that they don't get sick during the transmission season. And one of the key drugs used for that is sulfadoxine-pyrimethamine, which has been really effective in many clinical trials.
And Kelly, what does drug resistance mean in this context of malaria prevention?
Well, as a drug is used, the parasites adapt and become resistant to the drug. In the case of SP, it's quite complicated because there's not simply a resistant and a susceptible form of the parasite. There are many different genotypes with different combinations of resistance mutations, and those different genotypes are found in different regions of Africa. So the challenge with the project was to work out what the effectiveness of SP is in the context of these different genotypes.
And Andria, your recent publication looked at exactly this context of malaria prevention and drug resistance. What were your key findings?
Yes, so as part of the PLUS project, we analyzed clinical trial data across multiple sites to understand the relationship between different parasite genotypes and chemoprevention with SP. What we found is that predictive efficacy of SP was much lower against East African genotypes compared to the West. But clinical trials are quite expensive and time-consuming to conduct, and we can apply our findings from this paper to molecular surveillance data, which is much simpler to collect, and therefore predict the impact of chemoprevention in any African setting.
Thank you so much for your time today.
Thank you.